you go to somebody for your procedure who has the most reps, just like, Arnold Schwarzenegger chasing that dream of being that perfectly body-built person, but it's the reps that got him there. The first thing you do when you wake up in the morning, you make your bed, you've already accomplished something, and it's, kind of structure regimen to your day. And I think that's huge.
How do you detach from those cases that are the really tough ones?
I call all my patients on post-op on Saturday mornings to check in, make sure everyone's doing okay. It's not something that I'll ever kind of completely detach from, but I can compartmentalize stuff in my mind pretty well.
In this episode, we'll cover a lot of great stuff with Dr. Pasquale Eckert, who is a peak performer at the highest level. You're going to love it. This week's charity is Make-A-Wish Foundation again. That's 2 guests in a row. So please go ahead and subscribe, and share it with a friend. Oh, and also leave a comment about the episode and what you liked. We really appreciate it. It really helps us here at the channel. And welcome to the show. So here in California, dude, right?
Yeah.
Welcome.
Made it.
Welcome to the left coast.
Thanks for having me.
Yeah, it's awesome.
The West Coast, I don't know if it's the best coast yet.
Yeah, I mean, I think that's a debatable thing, right? I mean, the last time I saw you, it was on the East Coast.
Yeah.
And that was fun. We had a good time.
Yeah. Yeah. In town of Belmont. Yeah.
Yeah. Yeah. That was an interesting dinner. Good little sidebar.
Yeah.
So tell me how it all starts for you.
Like my career, or
just as a kid, I'm sure you were super motivated from the gate.
As a kid, I was probably a pretty average student in high school, but I had a good group of friends and good family support system that kept me on track, I guess. As a kid, I pretty much all I cared about was when I could get to the ski mountain next, and skiing. I cared about skiing and hiking, playing outside, that sort of stuff. That was my big drive. And then when I got to college, I met my wife, and my first year of college, and we were study buddies. And I think that was a big part of my what kind of kept my nose to the grindstone is having that support system, that anchor in my life throughout college, throughout whatever social pulls there might have been, or whatever was going on. I had a I didn't know. She was just a good support system. But yeah, I think my second year of college, I worked in my dad's office over the summertime, and I thought this is really cool. I know I want to do something medicine or dentistry related, and this oral surgery, maxillofacial surgery blends the two. So I kind of put my nose to the grindstone and became from a B, A- student first year of college, just straight through, just pushed hard, and got great grades. And I think I was accepted into 13 dental schools. I chose Tufts because I thought it could give me the best education, and I think it is the best dental school in the country. Tufts University School of Dental Medicine. And then I went to I was tried to stand out as a leader in class too. Same thing, kept my nose to the grindstone. Wouldn't go out and party that much, but I was very social in my class. I was class president for 4 years in Tufts, and I published 3 articles in the Journal of Oral Maxillofacial Surgery, 2 Recover articles. I think that helped me stand out a little bit in the field. And then I got into my first choice residency program, Tufts again, and went through residency, grinded through, skied here and there when I could. And now I'm on staff. I'm part of the Tufts alumni board too. And so go Jumbos for those that are watching. I think my work ethic partly was from my parents instilling that into me from a young age, and not getting caught up in some of the bad things that are circulating around society nowadays. And just kind of seeing that goal, driving towards it. And I'm a checklist person. So from whether it's my day-to-day routine house chores at home to studying for board exams, I'm a checklist person. I make a checklist of 22 or 50 items, and everything's ranked. Number 1 has to get done before number 2. And it might be, the checklist might be out of order when it first starts, but everything's assigned a number. And if I just start ripping through the numbers, I can see that progress, and that helps me get through any given task.
Talk more about that. Talk more about how that's not a habit that's a routine. It's like, it's something deeply ingrained in you.
Oh yeah, yeah, yeah. It's a routine. Yeah, in the morning, if I'm, a Saturday morning, we have my wife and I have a newborn. I guess he's 1 year old now, a son, and I mean, there's a lot of stuff to do in the day, and to get through everything, we need to make checklists. I mean, I make checklists. My wife sometimes might make a checklist, but I in my mind, if it's not on paper, my mind is gym early morning before baby wakes up. Um, you know, the next task might be, my wife's going to feed Graham, my son. Is I'm doing making breakfast for us, and then as the day follows along, it's based off the checklist. But yeah, I don't think that nobody taught me to make checklists. It's just studying and having so much to do as class president, from trying to negotiate stuff with the curriculum for certain classes in dental school, to studying for exams, and trying to schedule out time to see family and whatever it might be. It was checklist was the only way it was going to get done.
Yeah.
But
So dental school, I mean, to get Tufts, you got to be number one to make an OMFS program. Pretty hard to make those. There aren't that many programs, and you've got to be in the top of your class in order to actually do it. And so you choose Tufts, and tell me about like year one.
year one at Tufts was tough. So Tufts was a trauma one medical center. So seeing how everything from knife wounds to big facial neck abscesses and big surgeries. So it was busy. There were definitely 2-3 day periods where I wouldn't get a chance to go home, even though home was like 3-4 blocks away. I, but it was good. I think that helped to continue that work drive, that work ethic, and we had to be at the hospital to take care of the patients, and I'm glad that it was so intensive, because the training that I got. I mean, if you can train someone for 100 hours in 1 week versus 40 hours in 1 week, the training is going to be dramatically different spaced out over a 4-year period. There's no comparison.
The intensity,
Yeah.
the intensity
and just the volume.
is way higher.
Yeah.
Yeah. I mean, and the other thing too, most people don't really understand, like we talked about it before, oral and maxillofacial surgery, like bridging the gap between, dentistry and medicine. People don't realize, like, hey, if there's a trauma, and you need to have your face completely reconstructed, there's a good chance it's going to be you.
Yeah. Yeah. So it's 50-50 at any given medical center on, if ear, nose, and throat doctors or the OMFS doctors will be the treating trauma doctor. And it's really whoever's on call that day. And when you have trauma, you don't get to choose. It's just, whatever's there. Tufts is an awesome program. Sounds like I'm making a plug for Tufts. I'm not, but Tufts is great.
You're going to send me a check. We already worked it out.
Am I cutting into that?
This episode is sponsored by Tufts University.
That'll help with the Tufts is expensive now, the tuitions. But Tufts is cool because it's so well rounded. So there's the planned orthognathic surgeries where we're moving jaws around. There's the trauma that comes in through the ER, and then there's so many dental implants and wisdom teeth cases, because the dental school is the second biggest dental school in the country, and they're just feeding the oral surgery department implants and wisdom teeth patients all day long. So there's not like a wisdom tooth season at Tufts. It's wisdom tooth season every day of the week,
24/7.
So that there's no shortage of training. That's part of why I wanted to go there, to be friends with people in the community, be friends with the other doctors, prosthodontists, periodontists, general dentists at Tufts. A lot of my, or I guess 3 or 4 of my professors from Tufts that taught me how to do operative dentistry now refer to me out in the practice. It's something that I never thought that would happen, but it's great to talk with them and have them continue to be a support system for them, and have them be a support system for me.
Yeah.
I'm still learning. Everyone's learning every day. That's why it's called the practice of, and medicine is never going to be perfect. There's never going to be a guarantee with any procedure or any sort of medication. There's not a magic pill that's going to do one thing or another, and that's why there's 10 different blood pressure medications as like the first line therapies, because there's a side effect and not everybody's going to tolerate that the same way.
Yeah, for sure. Yeah, you mentioned orthognathic surgery. So many people just don't even know what that is, but when you really think about like the end result of that, it's unbelievable. Like you see those patients and the results that you can achieve.
Yeah, so orthognathic surgery, for for those who don't have experience with it, comes from the Greek words ortho, bone, and gnathia is jaw. So orthognathic surgery means bone jaw surgery, just it means straight jaw. As oral maxillofacial surgeons, will make an incision inside a patient's mouth, below the upper lip, and in the back of the lower jaw, all inside the mouth, and make cuts through the gum tissue to then access the bone, and then cut the bone and move it around and plate it in the proper position. So if you think back to, I believe the movie Jaws, the James Bond movie, where Jaws he's got acromegaly, he's got a big face, and when you have acromegaly, your lower jaw grows outwards into this kind of protrusive big underbite.
Yeah.
So the procedure for that person, that patient, could be to bring their lower jaw backwards and bring their upper jaw forwards a little bit to kind of compensate that and set the bite so the teeth are just right. So you can bite into a sandwich and size through it and cut through it just like you would like to. It is life-changing for everybody from a functional standpoint, but then an aesthetic standpoint too. It balances out those facial features to make things more beautiful. And I think the beauty of nature and the evolution of the human is that we're all a little bit different. And if two people get together and make a baby, even if they look very similar, their baby's still going to be an incredible different variation of them. And that's what helps the species kind of diversify a little bit too.
Yeah.
Anti-species.
And then you have these incredible sort of like quote unquote deformities, where you see somebody has they have no chin, and they have, sort of like this, recessed chin, or they have the, really pronounced version of. And it's amazing to see those cases where, holy smokes, when these people come out, they just look like totally, I think of all of the procedures. I mean, obviously you're doing arthroplasty. So for those people that don't know, arthroplasty is, moving an ear that's like protruding or something like that, or, and you're qualified to do any kind of facial plastic surgery, cosmetic surgery. But those, I think when you're talking about structurally, the notion of actually taking those jaws and moving them in a way where it's all of a sudden you look at somebody, I've seen pictures where I'm like, wow, it's just that dramatic.
I think the biggest movement I've been involved with was I guess one of my patients post residency was a 12 millimeter change, and that's a centimeter, 1.2 centimeters. So it's a big change for someone who's had a very small jaw. And we brought that patient forward and did other couple things to modify their bite a little bit too. But it's life changing from a social standpoint, a confidence standpoint, and functional is great too. So,
yeah,
everyone benefits, but certainly some people do require like a otoplasty. So like you're saying, plastic surgeries for the ear to correct some minor aesthetic deformities, and just aesthetics. Sometimes no deformity, that they just want to change their ear. I don't do those procedures, but there's a lot of people in our field that are.
I was hoping that I was going to be able to come to your office next week and just like, no,
we have to fix the pixie ears and the pinned ears now. That hasn't been in my not yet. Yeah,
there are some really great guys at that, by the way. Like there's some guys who are really top notch at that and have a lot of more reps in that particular procedure across the country.
That's what it is at the end of the day. It's you go to somebody for your procedure who has the most reps, just like Arnold Schwarzenegger was Mr. Universe or Mr. America, I guess, for getting the most reps in and getting his biceps swole, and chasing that dream of being that perfectly body built person. But it's the reps that got him there, and it's the reps. You want to go to somebody that's doing a lot of wisdom teeth extractions or just implants, a lot of ears, whatever it might be, nose jobs. You want to go to somebody that's what they do all day long. And that's their bread and butter. And it's so routine to them. The complex is so routine. It doesn't matter. It's just another day at the office for them.
You can take a look at like what's sort of happening in dentistry. There are a lot of general dentists there's a huge disparity in training. They don't have the anesthesia and residency that you have. They don't have a lot of the things that they just don't have the same level of training. And yet they're trying to do a lot of, and I know we're not here to disparage dentists on a whole in any way, shape, or form, but there are a lot of dentists that they push the boundaries of the scope of their capabilities. And I think, it's questionable.
I think there's always going to be a place for oral surgeons in any community to take on the more difficult cases, and there are a lot of people that want to have their hands in placing dental implants as bridges may kind of fall out of vogue, and bridges are a fantastic option, especially for some people who do need a crown on both the neighboring teeth or aren't a good candidate for oral surgery because of medical comorbidities. And bridges are fantastic, but when we can, putting a dental implant in is definitely the gold standard to keep it a one tooth problem. And a lot of times, there are general dentists that in my community who are fantastic and place fantastic dental implants, but they refer to me they're more complex cases. And I think at the end of the day, there's always going to be a home for oral surgeons to be king when it comes to implants.
Yeah, I mean, zygomatic cheratoids, all those types of
Yeah.
complex cases where there isn't a lot of bone and you're really trying to get in there and work with something that's like difficult it's one thing just to place an implant and, a totally healthy job, but when you're talking about osteonecrosis or, any of those types of situations.
Anyone getting multiple implants should go to sleep for the procedure usually. Anyone that's, having a more involved treatment plan that involves more than just like kind of a straightforward slam dunk implant should probably be seen by an oral surgeon. Somebody that has more training in that, and if necessary and if desired, can go to sleep for the procedure if it's safe for that. So, yeah, I think that's really what it comes down to. Is the big all on 4 cases, all on 6 cases. When we do those, people are most comfortable when there's some sort of sedation on board.
Yeah, I think it's such a heavy duty to have that many teeth extracted and then have those implants placed, and then it's amazing to see those patients wake up. And they're like, whoa, like they're crying, and
it's a great experience for the whole office. Everyone's psyched those days, and I think
it's just so it's like instantly life changing, even when they're in the temporary, the provisional. It's like wow, and you're gonna have to eat soft foods for a little bit of time, but eventually you're gonna be able to eat anything that you want, and those cases are pretty amazing.
And even with the temporary, like you're saying, like right off the bat, that we get them in teeth and they're psyched. A lot of them we have to explain this is just the temporary, and it's going to look even better, and to encourage them to come back for that post-op or that implant osseointegration, that torque check to make sure the implants are stable and torqued and spot and not having any sort of issues with their healing.
Yeah. Also, at that point in time, the swelling's gone down.
Yeah,
they're not in the same. The face doesn't look the same, so now you get that kind of. It's amazing to see like people who are missing that much dentition. How their faces are recessed and sort of sunken in.
Oh yeah, Kelly combination syndrome, and these patients, they're missing one set of teeth and just have a few teeth on the lower, and you get that kind of that sunken, almost like we were talking about with jaws, that class 3 we call it, skeletal deformity. Class 3 is forward, class 2 is back, class 1 is the normal chewing. So, but when you're missing a bunch of teeth, you do get this kind of sunken look to your face, and your lower jaw will protrude below and beyond the upper jaw.
Yeah.
So we can reverse that by building up that space with dental implants, and people do look, we'll go from that kind of more sunken in, that look like you're almost malnourished, to this like kind of full face, beautiful lip look, and it just takes a couple hours. So.
Yeah, it's amazing. Well, obviously, I know a lot of oral and maxillofacial surgeons.
Yeah, you do. You know a lot about oral surgery.
Yeah, probably more than I ever thought I would, but I'm not going to go taking anybody's teeth out anytime soon, so we're all safe. The reality is that I think the other thing we should probably talk about is wisdom teeth.
Mm-hmm.
And sort of the misconception. I can't tell you how many times I've heard from clients where it's like, hey, I've had the kid, it's the general dentist, like, hey, I've had the kid in the chair for 2 hours, but I can't get the teeth out. Can I send him over? And, you got to think, like, what's the right thing for a patient? You send to a specialist for a reason. And the reason is that you can produce a superior result. And in life, I think we always want to find the people that can help us get the best result the fastest. And I know, again, it's a touchy subject. There are people that can take out wisdom teeth that are just general dentists. But I think at the end of the day, it's like oral surgeons really are the most qualified, bar none, to produce the best experience for a patient.
We are, yeah, and we have that specific training in wisdom tooth extraction. And the cases will a full set of bony impact wisdom teeth takes 45 minutes. Patients are comfortable. They leave our office psyched and happy, and they're surprised that it was so relaxing and so comfortable. My wife and her family aren't in the dental field whatsoever, but they talked about how the first two children were the guinea pigs. And then after my wife, who's the middle child, had a really tough, couple hour long extraction for her 4 wisdom teeth. Her parents took my brother-in-law, my wife's younger sibling, to an oral surgeon for the final set of wisdom teeth. And he was in and out in like 15 minutes, best experience ever, no issues post-op. And I think that we can kind of reverberate that echoes through with every patient, that it can be an easy, smooth experience. No tooth should take more than 20 minutes to remove for an oral surgeon. Certainly, there are some dentists that can get great results with taking out wisdom teeth, but with the right tooth, with the right setting.
Well,
for the impacted wisdom teeth, people should go to sleep and have some sort of sedation on board again.
yeah, I mean, I think that's a huge. I mean, of all the teeth that you probably, many people have had teeth extracted, whether that was for braces or for whatever reason, but wisdom teeth are definitely, that's a sort of a strenuous exercise in removing those. So I think
it can be. I think with general conventional dentistry and the hand pieces, it can be a much more involved process. With our surgical hand pieces that cut through teeth, even the toughest teeth, in 3 or 4 seconds, it can be a lot quicker experience versus that process. Like to prep a crown, everybody knows, anyone that's had a crown knows that the process to cut a crown takes 30-45 minutes or so, and that's not even cutting through the tooth, that's just cutting around the outside of the tooth. So the surgical hand pieces that we use definitely are, the equipment that we use is more equipped for oral surgery and cutting through, if necessary, cutting through bone to remove impacted wisdom teeth. And whatever else, cysts or tumors or whatever might be around, in the lower or the upper jaws. It's easily access.
So those are the things that you do on the day-to-day,
Mm-hmm.
right? I mean, you come out of residency, it's kind of like you're flying out and you go out into private practice, and, you maintain some, connection, obviously, with the hospital and the faculty position in some way, shape, or form. But when you first start working in private practice and you're doing this, like how do you stay motivated? What are the things that you do beyond the checklists? Like, what's the internal dialogue going on in your head? What are the things that are like driving you?
Oh, geez. I think it kind of boils down to patient care. And I've had my wisdom teeth removed. I've had other oral surgeries too, and I've had some complications afterwards too that aren't expected. My dad's my oral surgeon, and things happen, and I want people to understand that we're going to do absolutely everything we can to make this a smooth experience for you. And I think what drives me is that patient experience, and trying to make it a good experience for them. Outside of the office, what drives me is my love for playing sports and hanging out with my wife and son and family. I like to golf. I like to ski. Like I said, 9 times out of 10 or so, if I could pick the vacation or something, it would be a ski vacation. If I could just be finding some cliffs to jump
Real
off.
off. Yeah.
But yeah, trying to relax. I think have that work-life balance helps too. And since my son was born, I haven't worked out quite as much as I used to. Certainly not. But having that as like the first thing I do when I start my day. I'm not a night owl when it comes to the gym. I couldn't go to the gym at night, but I wake up, have a protein shake or yogurt, banana, something, and then get right into the gym. It makes you feel like you've kind of already accomplished something in your day. Just like I think I'm blanking on his name right now. But I want to say Jock Putney, but it's not Jock.
Yeah.
Jocko. Oh, well, podcast. I think he goes back to the first thing you do when you wake up in the morning, you make your bed, and you've already accomplished something, and it's kind of structure regimen to your day, and I think that's that's huge. Having that structure helps drive the next thing, and you've accomplished one thing, go on to accomplish the next thing. And it's maybe not a checklist, but it is, kind of almost like a data driven, moving forward in like a binary motion.
I mean, you think of like, you talk to a lot of tier 1 operators about like, I had my buddy Jeff Harp in on the show, and
the Navy SEAL guy.
No, it's FBI guy.
Okay.
And what hasn't this guy done? I mean, he's incredible. He said the same thing. It's like, hey, make your bed. Just get up. It's routine, but it's stacking accomplishments. It's like, hey, okay, that's one victory down. Let's go. How much higher? That's kind of why the path to peak performance, in some ways, is limiting in what you can do with a podcast. But the goal is to get to what is that one thing that somebody might hear that actually resonates with them. And you need a lot of different types of people in order to get to that place where someone can actually hear, oh yeah, I can relate to that. That's actually makes sense to me. And so the way I look at it, it's like, hey, I get up and I go to the gym. I like to work out early in the morning as much as I possibly can. I will admit there are some times on the weekends with certain commitments, going to go a little bit later. But I like to get up, I like to get into the gym as early as I possibly can, because then I feel like, man, I have crushed this day already.
Yeah.
And then you feel stronger. Then you're also not kind of thinking about it. Hey, what am I going to do when it's time, in the afternoon? Am I going to have the energy? And I think, we work in a rigorous, let's just say it's a rigorous environment.
Yeah.
Those
Stressful with clients all day, very demanding clients. Hopefully I'm not too much of a thorn in your side, but stressful with patients too, and very demanding.
You are like a pleasure to work with. What I would say is like, there are those guys that you want to get off your roster as fast as you possibly can, but you're not one of them.
They're not invited for the podcast.
Generally, no. I mean, it's a new podcast, so I'm sure there are going to be a lot of oral surgeons on, just because they're interesting personalities. Each one of them is kind of funny. One of the things I've learned over the years in working with oral surgeons, plastic surgeons, cellular medicine doctors, functional medicine, they all can kind of do the same thing, but they all do it in a different way, and their thought processes are different as well.
Yep.
So it's sort of interesting to hear sort of like where people are coming from. And I think that's what's important for people. It's like, hey, I could interview the next 6 guests could all be oral and maxillofacial surgeons. And there's going to be something that's like kind of unique or interesting about them in the way that they approach things, which is kind of cool.
Yeah. I think in residency too, I mean, everybody was so different. That's what was awesome about residency, all these different brilliant minds kind of coming together. And definitely you have this, I have this, kind of outsider syndrome, or imposter syndrome rather. Like when you first get to residency, like these people are really smart. They know a lot. And I mean, the way I compensate with that is I just try to read all the textbooks I can, just memorize everything that I could, just to work through it. Try to know more, and more. So I don't say I don't know when I'm asked a question. But
let's go back to residency, because I mean, for a lot of people, if you think about dental school is kind of like boot camp. Talk about it like a day in the life of residency. What's it like? How does it start?
Day in life of residency. So there's on service and there's off service. And off service is like general surgery, anesthesia, cardiology, pulmonary, but the other medicine specialties, which are, except for general surgery, all like a little bit more low key. Then there's on service when we do, I think it's a tough, so we did 36 months of oral surgery specific. So on service was most of your time. Day in life, I wake up, start making coffee and soaking my cereal as I was showering. And that might be like my first year. Maybe that was like at 4 a.m., 4:30 a.m. Could be on the worst days. I'm picking one of the worst days. Start making the coffee and everything. So it's like ready to go. It's jump out of the shower, put on the scrubs. Actually, my first year, we couldn't wear scrubs outside of the hospital, so I would always change back and forth. But put on scrubs or whatever outfit, and like wolf down breakfast and start pre-rounding on the patients. So that's rounding before the senior residents and before the attendings come around. So you check in with all the patients, see how they're doing over the night, how pain control is, see what medications they've taken, write out their vital signs. We'd get a census ready for the senior residents and the chiefs, typing it out, everything. And then by 6 a.m., the other residents would start to trickle in, or 6:30, and we'd round on everybody before 7. So we'd circulate through our hospital patients by 7 a.m. or so, come up with a plan, put in their orders into the computer for the day and whatever medications they need, and plan out the surgeries for the day, and then or look at the plan for the surgeries today. Then we'd have other meetings and kind of educational, like we give lectures. As a first year resident, we would give that lecture, or as a chief resident, I would be kind of guiding that lecture, or conducting the lecture with the first year residents to talk about pulmonology, or anesthesia, or whatever it might be, how to remove a wisdom tooth, with the attendings present as well. So we do some lectures, and then by 7:30 on any given day, that's when the first OR cases. So we'd be scrubbed in and in the OR all day, or you're in the clinic all day doing more the kind of bread and butter implants and extractions, anesthesia. So the clinic ran from 9 to 4:30. We didn't have a lunch break when I was there. Now I think the residents have a lunch break. It's a little more humane. And then at 4:30, you'd round on the hospital patients. Same thing, get a census ready, pre-rounding first, and then round as a whole group. By 6 or so, or 5:30, you'd be done putting in orders. Somehow you'd get some food in there. That was usually my second meal of the day. If I didn't get some, like, peanut butter crackers in the hospital along the way. And then I'd start prepping for the next day. Go home, get paged into the hospital usually in the middle of the night. A couple times, sometimes in the middle of the night, and or just stay over at the hospital if that was the case, and then do it again the next day. But it was you're pretty much living at the hospital, and kudos to my wife and all of the other partners of oral surgeons out there that can support their spouse or their significant other through this too. But she put up with a lot of just my sleepless nights and hearing that pager go off. I think she still has PTSD from that pager sound.
Sleep patterns never get repaired. It's like once they're damaged.
There's certain we had an apartment in South Boston after residency. We had a microwave that had the same beep as the pager beep, and we had to get rid of that. We can't do this.
I know, it's so funny for me with my kids. There will be an alarm that will go off, and I'm like, I got to be at this airport. I got to move. I got to go.
It's your airport alarm.
Yeah, it was like once it happens, right? You're never the same.
Yeah.
Like, some days are just like, where am I going next? What's the next piece of, it's insane, flying millions of miles and doing all that kind of stuff. So, all right. So you get to this certain point in time when you're also on call.
Mm-hmm.
Right, and you got to take difficult cases.
Yeah, so as a third year resident, you're doing more of the difficult calls. You're kind of doing a lot of the procedures in the ER for like facial lacerations, or as a first year resident, you are too, depending on what's going on. But you're doing more of the OR cases as a third year and a fourth year resident. So as chief, you're kind of running the show and picking and choosing your cases. And as third year, you're scrubbed into every single case, whether you're full on doing the case or not. But yeah, you're there. And first year is like you're there when you can be. And now I'm on call at 2 hospitals. So I'm on call at Tufts Medical Center still, and at Mount Auburn Hospital in Cambridge, Mass. But it's not as intense as it used to be. I mean, I'm on call every 6 weekends, every 8 weekends or so for Tufts. And then Mount Auburn's every 3 months or so. I'm on call for the month. So I have to be grounded in Massachusetts, but that's okay.
The one thing I'm curious about in that is, you see some pretty,
gruesome stuff.
Yeah. It's nothing nice, right? It's pretty.
So everybody goes to the ER. I think at any point in time, any person from any walk of life, any demographic, any part of the country has gone to the ER for one thing or another. And you see all parts of society in the ER. It's like that one really true melting pot that we have left, maybe, is that everybody goes to that same ER depending what's going on. So it's incredible place. It's a machine. And I think any ER, there are some little hiccups along the way, or things that are less efficient at one hospital versus another hospital. But we were talking about scooter accidents before, but as we see more and more electric scooters, it's incredibly dangerous. People are riding around these scooters on two a pair, no helmets on. But some of the worst trauma I've seen has been from electric scooter accidents, from people breaking their jaw in four different places, needing joint replacements from scooter accidents. Just really nasty accidents because people are flying around at 20 miles per hour, and then somebody opens a car door, and then they're all of a sudden they're flying head first into the car that's right next to them, or into the asphalt, and it's dangerous. And cities have seen that, and they're trying to bring them back, but it's almost too late, especially out here on the West Coast. It looks like Denver area, and I don't know what the laws are now, but I went to Denver a couple years ago, and there were like scooters littering the sidewalks, people zipping around everywhere on scooters. And, so that's something that kind of stands out to me. But it's dangerous.
They've been dangerous for a long time. It's amazing, like, I mean, how they've been able to kind of survive, not be outlawed in some way, shape, or form, because there have been so many accidents associated with them. One thing I'm curious about is how, for a guy that cares so much about his patients, because I know you do, like, you genuinely care about every single case, you care about every single patient, you want to produce the best result.
Yeah.
You're committed to that. How do you like detach from those cases that are sort of like the really tough ones? Like, let's say, I don't know, some sort of cancerous tumor in a mandible or something like that.
So I don't fully detach from it. I think I always kind of carry it with me. But I'm on call 24/7 for my office. If you call me right now, my phone's going to go off. I'm going to feel it in my pocket. And that's something I saw my dad doing my entire life. Growing up, taking calls when we're at the ski mountain, or taking calls at the beach, or when we did a big family trip to Italy. He was talking to patients the whole time. And that's something that I'll do. And my wife is, again, she's incredible. Georgina is awesome, and she supports me with that too. But so I don't detach. I don't fully ever detach, especially as a business owner too. It's something that's always there, but I try to compartmentalize it as much as possible. And initially, when I was first in practice, I would talk about a lot of the stuff with my wife, and now I try not to talk about from the business side of things to day-to-day patient cases. I try to just leave that at the door when I step into my house. And when my phone goes off, I'm going to be taking that call. And I call all my patients on post-op on Saturday mornings to check in, make sure everyone's doing okay, and or Friday evenings. But it's not something that I'll ever kind of completely detach from. But I can compartmentalize stuff in my mind pretty well.
I think you have to.
Yeah,
the survival mechanism, right? I mean, because you're gonna
you
have
probably do it with your kids and work too.
Oh yeah,
as you detach.
You have to, right? I mean, there's no other option. You've got to come to a point in time where you've got to be able to just sort of like, oh, hey, it is what it is, and it's going to be what it's going to be, and how you're going to handle that is really, hopefully you keep yourself in a fit. Some people have different disciplines to help them get to those places, but it's not easy.
I think with oral surgery too, I think, and I explain to people with the consults too, and that there's unexpected, unpredictable things, and we're always learning new things about dental implants or zygomatic implants, and these all on X full restoration sort of things. And someday it will be 99.9% predictable, hopefully, but there's always going to be that uncertainty and the patient element to it too. But I think day by day try to compartmentalize things as much as possible, but we're also always there for our patients, and I think that's what people want to hear and want to know too. And just knowing that helps a lot of people. And if there's a problem, you can call me at 10 p.m. on a Friday night, and I'm going to be there and answer the phone, or all the systems set up where an assistant can cover me if can't take the call for a certain moment. But
yeah, for me, obviously I don't deal with people the same way that you do. It's a totally different thing. But one of the things I think about, like, now, as my career's kind of gone on, it's like the stem cell banking piece, and getting stem cells from wisdom teeth, and really focusing on how that can really help people.
Yeah, do you want to talk with me about stemodontics a little bit, because I know about it. I know that we're banking stems, or people choose to bank their stem cells with their wisdom teeth afterwards. But how does it all work for those that don't?
I mean, well, if you look at it, deciduous teeth, or baby teeth, that by the time they come out, there's nothing there. It's like the tissue's bad.
Yeah.
For a long time, I think people were just sort of freezing teeth. And I think when we did the runs in the lab, and and this is at a university level, where worked with 2 different universities to develop a GMP, so good manufacturing practices, a protocol that was enabled us to actually get this result, right, where we could actually transport the teeth in a media that kept the teeth nourished and sterile while out of a blood supply. And you have a shelf life on that. There's only a certain amount that you can actually do, how long that will last. Then getting them into the clean room is another thing, and then being able to open those teeth up, get the pulp out, and having that pulp where you can actually expand, separate the pulp from the stem cells and then expand the stem cells.
Like so time is clearly of the essence.
Yeah.
And then PCR, it sounds like, is the polymerase chain reaction that you're doing to increase the stem cell count.
Right.
How much time do you have between moment of extraction to PCR starting?
Yeah, sure. It's funny because we've had things where it's like you never really know. We have a super high success rate in the lab, and I think that has to do with this proprietary media that we developed that no one else has. Which there's a little secret sauce, a little secret formula in that. But the reality is that, so then we talked about earlier, sort of like, hey, so one person can have a vaccine and they can have a totally different reaction to that. So it all comes down to the biology of the person. But most of the time we're looking at a 72-hour window. So you're going to FedEx those teeth to the lab. The lab's going to receive them. They're going to see if they can actually make it through. They're sterile enough to make it into the clean room. Once they go in the clean room, you're then getting them into the, it's hood space and technicians, right? So it's basically the ability to actually process the teeth. The cryo part's the easy part.
So it's easy.
Yeah, that's that. When you're essentially putting it into a solution,
dry ice or something.
It's like the antifreeze, right?
Okay.
So we all know that a cell has water. So if you freeze, that's why when people freeze teeth, I kind of laugh, right? I didn't know initially, but it made sense to me when I heard it. It's like, yeah, of course, you've got a water crystal. If you're going to freeze that, you're essentially, imagine it's sort of like, you like food, right? So we both like to grill. So imagine if you just go to the butcher and you get a steak and it's wrapped in, paper, and you just throw it in the freezer, whatever moisture was inside of that is actually going to crystallize, and it's going to make that steak's not going to be as good. It's not going to taste as good.
Absolutely.
If you vacuum seal it, it's a totally different deal. So this, media is like antifreeze for the cell. So it keeps the cell from freezing. And then, indefinitely can just sit in cryo. Once it's in there for a certain amount of time, it's essentially the equivalent of, it could be any amount of time. And you could bring it back, and it would be just fine. There's nothing would have changed in the state within that aliquot. And that's what I think is most exciting to me, because, when you look at what's happening in the stem cell world and the changes, like what we look now, we go, okay, look, some people call, Alzheimer's, dementia, Parkinson's, whatever, type 3 diabetes. We're learning a lot about the fact that, stem cells can play a huge role in neurodegenerative, in all sorts of conditions that exist out there. So, the hardest stuff is like a kidney capsule for cartilage. Because cartilage doesn't have a natural blood supply, so trying to recreate your own cartilage that you could, I think about, of the 9 orthopedic surgeries that I've had, like 5 years from now, I would have never had to have any of them. And you probably could just.
Well, I like that thinking. I hope that's true.
Right? Wouldn't that be great?
Yeah.
It'd be awesome if we could do that. And then you think about all the other applications. So, when you have a heart attack or MI, like that, where you're having dead tissue, the ability to go in there and refresh that tissue, or diabetes, the notion that you could actually have a model and you could recreate tissue. There's a huge need for tissue. People that have cancer, where you're losing a lot of tissue, to actually be able to recreate tissue. So we just happen to work with a great team of people, Michael Longacre, Ophir Klein, the list goes on, really top-notch stem cell scientists that are essentially really leading the way. And there are a bunch more. There are a bunch more that are out there, and, Stanford, UCSF, the list goes on. But yeah, it's a pretty exciting time.
That's great. That's great.
Yeah, really pumped about it.
I think you were saying that you're expanding lab space for it too.
Yep.
Right.
Yeah, that's the plan, is like, to really have the ability. I mean, because at the end of the day, when we first started the business, you're like praying that you could get a case,
Yeah.
right? Like you could get somebody that would actually pay for it to try it, because the FDA hadn't approved, and still hasn't approved this class. It's like creating a class of drugs. So you're sort of selling the promise of the future that is unknown, and only a certain number of people are going to actually do that. Then you get to a certain point in time, you're like, oh my gosh, I hope we don't get another case this week, because then we won't be able to actually process it. And then it's going to create a problem. So we've been able to do the right thing for the business, and I think come to a place in time where we're like, big things are kind of in the works. So that's exciting. But back to you. So you love to ski, you got a family, you got a growing practice, you're doing all sorts of things. For the young kid that's thinking about, hey, I want to be a doctor, whatever the specialty might be.
Yeah.
What do you think is the most important thing that they focus on?
Well, first, I think having a drive and knowing what you want to do, figuring out what that is early on helps, so you don't lose precious years of your time trying to, stack a resume after college, or get that organic chemistry course that you just didn't know that you needed. So I think in early years of college, between summer jobs, or on weekends, if you can, call your local oral surgeon, or call your local orthopedic surgeon or eye doctor, whoever it might be, if you're thinking about one specialty versus another. Just asking if you can shadow them, and see what their schedule, their day-to-day is like. And don't just shadow one, shadow a couple, because from one eye doctor to eye doctor, things are very different. And from one orthopedic surgeon to another, one might be doing finger surgeries and you might find that incredibly dull. And another might be doing hip replacements, and that might be really cool to you. So I think finding somebody that can be a mentor to you, and a mentor isn't somebody that just, shows you the ropes and shows you the way. A good mentor, is somebody that wants to help you and give you all of the knowledge that they have, and impart onto you every little bit of wisdom that they can, from the application process to, which dental school might be right for you if you want to do oral surgery versus if you want to do orthodontics, and what might be a good person to ask for a resume, for a recommendation. A mentor is somebody that will impart all the knowledge that they have onto you, with no reservations, and there's nothing in it for them, except for to see you grow. And a lot of times to find that true mentor is difficult. And I'm not going to be that true mentor for everybody, but for some people that could be me. I mean, for me, that was my dad, and that was one of the oral surgeons that was at Tufts, that told me absolutely everything that he could about oral surgery, and this, that, and the other thing, and we're still close today. But I think having somebody be that mentor is critical. To find that mentor early on too is important. If you think about medicine, if you think about dentistry, exploring both is great. I mean, I think oral maxillofacial surgery is the greatest career in the world. I think that there's so many different ways that you can go with it, from, just doing teeth and titanium, as people say, to taking, trauma call, or just treating, tumors in the jaw, or facial plastics. If you want to be a plastic surgeon, you can be a plastic surgeon. Not to step on plastic surgeons' turfs, and there's some things that will always be plastic surgery, but for facial plastics, that could be your thing. So I think the big thing is, for someone that's looking to do something in medicine, is to find a mentor that can help you, and kind of show you how they made it to their point in their career, and not somebody that we can just talk with one summer, but somebody that you can come back to, not just email with, but you can text with, and ask, what do you think about this?
Sage advice. I mean,
Yeah.
having a mentor in anything, wherever you're going, is super important. And if you can find that one that you can really make a connection with, I think that people are often surprised to find out that how much people really do want to share
Oh yeah,
their knowledge with the younger generation.
people do. I mean, it's a feather in their cap if you're asking somebody, how did you do this? It's the narcissist in the human nature that they want to share. This is how I did it. This is what I think worked and didn't work. There are definitely things that don't work along the way that shouldn't have bitten that off. That was a little more I can chew that time, or whatever it might be. But
Yeah.
there's definitely pitfalls for every career, and yeah, I think finding a mentor is the biggest thing to me.
That's great. Hey, great to have you in.
Thank you, John.
Thank you.
Good to be here.
Hey, thanks everyone for watching the show. Please remember to like, comment, and subscribe. It really helps us out here at the channel, and share the video with someone who might be interested in supporting the charity that our guest mentioned in the episode. Thanks again. We'll see you soon.